Have you ever walked into a room and completely forgotten why? Or maybe you felt your mood dip for no reason, just a heavy cloud over your day. Maybe you've noticed your muscles feeling weaker than they used to, even though you haven't changed anything about your routine. If any of that sounds familiar, and you're over the age of 60, what I'm about to share might just be one of the most important things you hear today. Hi. Welcome to Health Simplified, where we focus on practical, honest, and science-backed ways to take care of your health, one day at a time. I end today's video, we're going to talk about a silent deficiency that affects millions of older adults, often without them even realizing it. It's not talked about nearly enough that it doesn't always show up on routine blood work, and yet, when left unaddressed, it can quietly affect your memory, your mood, your muscles, and even your heart and nerves. This is the story of vitamin B12, a vitamin that your body depends on every single day, especially as you age. But here's the catch. As we get older, our ability to absorb this vital nutrient drops sharply. Even if we're eating all the right foods, so grab a cup of tea or water, sit back, and let's explore how a small, invisible deficiency can have a big impact, and what you can do to protect your brain, your body, and your future. Let's begin. Part 1. Why B12 matters more after 60. Let's start with the basics. What is vitamin B12, and why is it so important for seniors? Vitamin B12, also called cobalamin, is a water-soluble vitamin that plays a crucial role in building red blood cells, supporting healthy nerve function, assisting in DNA synthesis, maintaining energy levels, and protecting brain health. Here's something many people don't realize. Your brain absolutely depends on B12 to create neurotransmitters like serotonin and dopamine, the very chemicals that control your mood, motivation, focus, and memory. Without enough B12, communication between your brain cells starts to break down. That's why one of the earliest symptoms of B12 deficiency isn't physical. It's often emotional or cognitive. You may feel foggy or forgetful, easily confused, anxious, irritable, or even mildly depressed, unmotivated or low energy, even after a full night's sleep. And because these symptoms can creep in slowly and subtly, many people assume it's just aging. But here's the truth. Aging may be natural, but mental decline from B12 deficiency is not. Part 2. Why is B12 deficiency so common in seniors? You might be wondering, if I'm eating well, how could I be low in B12? And it's a great question. The problem isn't always intake. It's often absorption. Here's why B12 deficiency is especially common in older adults. 1. We produce less stomach acid with age. Stomach acid is needed to separate B12 from the proteins in food. Without enough acid, B12 can't be properly absorbed. Many seniors have a condition called atrophic gastritis, which severely reduces acid production. Point 2. Common medications block absorption. Acid blockers like omeprazole, Prilosec, lansoprazole, Prevacid, or ranitidine, Zantac, these can reduce B12 absorption dramatically. Metformin, a widely used diabetes drug, also reduces B12 over time. Point 3. Dietary patterns change. B12 is mostly found in animal products like meat, eggs, and dairy. As we age, appetite may decline, and people may cut back on these foods. Vegans and vegetarians are especially at risk unless they supplement. Point 4. Gut health issues. Conditions like IBS, celiac disease, Crohn's, or even past surgeries like gastric bypass affect how nutrients like B12 are absorbed. All of this means it's very possible to have low B12 even with a good diet. And here's the concerning part. Many doctors don't test B12 levels unless you specifically ask. Yet deficiency is incredibly underdiagnosed. Part 3. Signs your body may be starving for B12. Let's walk through some of the warning signs that your B12 might be too low. Some of these are obvious, but others are so subtle that they're often ignored until serious damage is done. Memory problems, trouble concentrating, forgetting names or appointments, feeling like your brain is in a fog, mood changes, mild depression or anxiety, emotional numbness, irritability without cause, muscle weakness, difficulty climbing stairs or lifting grocery bags, a heavy feeling in your arms or legs, numbness or tingling, pins and needles in your feet, hands or legs, a burning or buzzing sensation, feeling like you're walking on cotton balance issues, feeling unsteady on your feet, trouble with coordination, increased falls or near falls, fatigue and low energy, waking up tired, feeling sluggish all day, needing naps more often, pale or yellowish skin. This is due to poor red blood cell production, a classic sign of anemia from B12 deficiency. Now here's something crucial. Many of these symptoms can mimic early dementia, depression, or even MS. That's why B12 deficiency is called the great imitator. Part 4. Testing and diagnosing. Don't rely on symptoms alone. If any of this sounds familiar, the next step is to get tested. But there's a catch. Routine blood tests may not catch early B12 deficiency. Here's what you need to ask your doctor. 1. Serum B12 level. This is basic but not always reliable alone. Point 2. Methylmalonic acid, MMA. This rises when B12 is low, even if your serum B12 is normal. 3. Homocysteine. High levels can indicate B12 and folate problems and are linked to stroke risk. Ask for all 3, especially if you have symptoms, and if your B12 is below 400 pg/ml, even if your doctor says it's normal, you may still benefit from supplementation. Part 5. What to do if you're low in B12. Thankfully, B12 deficiency is one of the most reversible problems in senior health. If caught early, here's how to start correcting it. 1. Dietary boost. Add more B12-rich foods to your diet. Eggs, especially the yolks, fish like salmon, tuna, sardines, beef and chicken, milk and yogurt, fortified cereals. Check the label. 2. Supplements. If you're not absorbing B12 well from food, supplements can help. Sublingual B12 under the tongue. Absorbs directly into the bloodstream. B12 injections, often used if levels are very low or symptoms are severe. Nasal sprays. Another option for direct absorption. Look for methylcobalamin B12, which is better absorbed than the cheaper cyanocobalamin form. Talk to your doctor before starting high doses, especially if you're on other medications. 3. Track your progress. Recheck your levels after 2 to 3 months of supplementing. Many people feel better within weeks. Clearer thinking, more energy, better mood. Part 6. Long-term protection for brain and body. Correcting B12 isn't just about avoiding symptoms. It's about protecting your future health. Research shows B12 deficiency increases your risk of stroke and heart disease. It contributes to brain shrinkage and faster cognitive decline. It worsens existing conditions like diabetes-related neuropathy. It may even affect your sleep and hearing. And here's the best part. Fixing it is easy. Just a few small changes can protect your brain, lift your mood, and strengthen your muscles. You deserve clarity. You deserve energy. You deserve to feel like yourself again. If anything in this video resonated with you, please don't ignore it. Ask your doctor. Get tested. Take your health into your own hands. And if you've ever struggled with low energy, brain fog, or numbness in your hands or feet, leave a comment below. You're not alone, and your story might help someone else feel less afraid and more empowered. Give this video a like if you found it helpful. Subscribe to Health Simplified for more honest, uplifting, and practical health advice every single week. Your brain is worth protecting. Your health is worth fighting for. And you're worth every effort. We'll see you in the next video. Health Simplified, your health, your way, every day.